Hello, I'm Dr. Victoria Sorlie-Aguilar here with my friend and colleague, Dr. Diana Londoño, board-certified urologist. And we came together today, me as a family physician and Dr. Londoño, to talk a little bit about genitourinary syndrome of menopause. A lot of women are aware of what menopause is, but not so much aware of genitourinary syndrome of menopause that will impact up to 80% of women in menopause. And knowledge is power. So if we know what the symptoms are, if we know how it will impact us, then we can find out how to get help, how to get treatment, and not suffer in silence.
Yes, thank you so much for having me here today. We really want to give the perspective as a family physician because you're so passionate about your work and empowering women, and as a urologist, because we know as urologists, this can affect symptoms locally and what the area will describe soon called the vulva, obviously also the vagina, but it's going to affect how we feel during sex, if we have pain, if we don't. And it puts us at risk of infections as well as frequency, urgency, and a lot of symptoms that are local to the bladder area and how we pee or don't pee with all the changes. So we're really going to talk about it from all the perspectives and what we can do about it. This is the most important thing. Again, understanding what's going on and you deciding what to do and really preventing, which we'll talk about, infections, which is the worst outcome that can come from this when there's dryness, puts you at risk for infections, and we don't want to be in that place. So we're really going to explain the anatomy and what to do about it today.
So menopause is when it's been a year since your final menstrual period. It means your ovaries are no longer producing estradiol, which is the body's natural form of estrogen, and it impacts a woman from head to toe. We have estrogen receptors from head to toe. So we might get insomnia or moodiness. We might get hot flashes or night sweats. We might get everything that happens below the belt, genitourinary symptoms. And that's what we're talking about today, because since our vaginal vulva tissue has estradiol receptors and our tissues are supported by estradiol, when we're in menopause, when we don't have that hormone, a whole cascade of symptoms start to happen and impacts our daily lives in so many ways. And today we're going to talk about what those symptoms are and what we can do to start and get some relief.
Yes, so important. That's a huge topic of the systemic symptoms that we have when there's menopause. That's important to know. But today, again, we are focusing on what happens around the vulva and around the vagina. So, what happens with menopause? Well, the tissue itself is going to change and there's going to be vaginal dryness. And that's going to feel like burning or itching or discomfort. And many times women say, oh, there's itching and they think it's a yeast infection, but it really is dryness. So if you're menopausal, again, no period for a year, and you're feeling that itchiness without discharge, it's very likely this is dryness. The tissue itself, because there's no more estrogen, gets thick, thin, and weak, and it's going to make changes on how you feel during sex. It's going to be likely have less sensation. There may be pain, and it's going to change also the orgasm sensation as well. When you pee, because the tissue is so dry, it's actually going to burn. So it may not be an infection per se, but when the urine, which can be acidic, touches the tissue that is dry and thin and fragile, it can burn. So sometimes it can actually mimic an infection, and the urine culture is negative. There's no bacteria, but it burns because of the dryness. So it's really, really important to address not only what's going on in the bladder, but what's going on in the tissue that touches the urine. When the tissue gets dry, also some symptoms like frequency to go, like an urge to go, can be worse because it's so dry that you always have a sensation or an awareness that you need to go because that tissue is just dry and uncomfortable. It also puts you at risk for incontinence leakage. So you lose the control when the tissues get dry. So whether you cough, sneeze, jump, and you are leaking, it can be contributing to that. And that also can be because of the support of the urethra. So that also happens with all the muscles and the tissue that support the urethra. If it gets weaker from the lack of estrogen, it can put you at higher risk of incontinence when you cough, sneeze, jump, that's stress incontinence, or urge incontinence. That means you're trying to get there and you lose urine. Again, the bladder can be a main issue as well, but if the tissues are dry, it's going to put you at a higher risk. And when the tissue is dry, if you're menopausal or perimenopausal, which is just a few years around menopause, that puts you at risk for an infection. Well, why? When the tissue is dry, doesn't have the lubrication it normally does, the bacteria that we all normally have around the area can get up into the urethra much easier and quicker. So a woman's urethra is very short, about 2 to 3 centimeters. And so if the bacteria is there that we normally have, and we don't have the defenses anymore or the lubrication that we had before menopause, the bacteria gets inside the bladder and it starts causing the symptoms of an infection. Frequency, urgency, pain, cloudy urine, and smelly urine as well. And then when you check a culture, the bacteria is there and there's 100,000 colonies of bacteria. So that's that UTI or infection when you have the symptoms and the culture is positive. So the biggest risk factor I see is that there's dryness. So we're going to talk about what to do. We're going to show you the anatomy, and then we're going to tell you what to do to prevent those infections that can end up in the ICU and intensive care and really, really sick from an infection. So let's prevent it before we get there.
Absolutely. Love it. So how can we care for our vulva and our vaginas? So the easiest, quickest thing we can do before we even visit our doctor, we can be shame-free and proactive about getting lubrication and using that during intercourse. Because of the friction, because of the more fragile tissue, we really, really need to use plentiful lubrication. We can get this over-the-counter KY jelly. There's many other brands. For about $10, a woman could use lubrication during intercourse. And also we can buy over-the-counter vaginal moisturizers like Replens. There's many other brands. KY makes a version as well for about $10 to $15. And women can use this intravaginally a couple times a week to help with moisturizing the vaginal walls. We can also talk to our doctor about low-dose topical vaginal estradiol, and we're going to talk about that more.
And yeah, we also want to talk about, well, what's supporting our bladder? Because what's holding up the bladder is that beautiful hammock of muscles called the pelvic floor. And I really think about it as a hammock. And with age, with pregnancies, or with increased weights, what happens is that support system can get weak. But also, again, like we talked about earlier, from the lack of estrogen itself, the support gets weak. And we know that when that happens, we can get changes. So the support system, which is the pelvic floor muscles, can either be a little too loose and fragile or lose its connection, or it can be tight, and that's a whole another separate lecture and symptoms. But when it is loose, then that can lose the support of the urethra, and then we can go to that stress incontinence where you cough, sneeze, jump, and you pee when you don't want to. So what can we do? Well, Kegel exercises, there's things that a physical therapist that is trained to teach you how to strengthen those muscles can help you with. And this is important because they're trained to do this every single day. They teach you how to do it correctly. Many times we are squeezing the wrong muscle, we're not doing it correctly, and it's not really going to help unless we get that training from a professional. So if you're having some of the symptoms of leakage with the cough, the sneeze, the lifting, talk to your physician, because you could be referred to a physical therapist. And again, also the estrogen, which we'll talk about, can help and make sure that those tissues are a little bit stronger and thicker and with more support.
And that pelvic floor PT is often covered by insurance. It's a service that your insurance can cover. So take advantage of that and have your doctor give you a referral to a place that's in the network of your insurance. Absolutely. So low-dose vaginal estradiol that we were talking about, what we're going to ask our doctors about, is only available by prescription, but it's different from systemic menopause hormone therapy that we think about when we talk about hot flashes and night sweats. That's systemic menopause hormone therapy, which is a whole other topic and is really great too. But what we're talking about today is low-dose vaginal estrogen specifically. This is low dose, it's topical, it only goes to the tissues of the vulva, vagina, urethra area, And its action, its estradiol absorption is only on those tissues. So it's safe for most women because it only acts locally, not systemically in the whole body. The women that would need to take caution and talk to their oncologist or their gynecologist would be those women who have breast cancer right now, or those women who have a uterine cancer or an estrogen receptor positive cancer. And they would know if they had those, and they could talk to their gynecologist and oncologist about whether low dose vaginal estrogen is safe for their genitourinary symptoms. It might still be okay for them, but they would need to talk to their doctors first.
Yes, absolutely. And in a minute you'll show us where to place this, because if we don't know where to put it, we it may not be working because we're just putting in the wrong place.
Yeah.
So estrogen, the great thing about it is that nowadays it can be obtained at a much lower cost. So this cream estradiol is generic. You can get it in your pharmacy, but now with a good RX coupon that you can get online or on the app, it's going to really lower your cost. And maybe your pharmacy is still a little bit more expensive, but you can find another pharmacy and the cost could be, again, around $40. Or there's also the Cost Plus Pharmacy by Mark Cuban. The price is around that $40 or so. So that tube is really going to last you 4 to 6 months, because all you really need is not the applicator comes in that you really can throw away. It's just really putting a pea-sized amount on your finger, and then you're going to put that pea-sized amount. The guidelines say 3 times a week. You can go nightly because, again, it's not absorbed into your body. If we check the levels of the hormones in the body, it's going to be still 0 estrogen. So it's not going in your body, and it's just going to act locally right where you put it. So you're going to put that there, and Dr. Sorlie-Aguilar is going to show us where should we put this cream, because that's the most important thing. If we don't put it in the right place, it's just not going to work. But again, it's really safe, and it's going to reverse those symptoms, those changes that we're having with menopause. My patients ask me, well, how long should I use this? You really have to use this for life, because now you are never going to make estrogen. And if you stop using it, it'll stop working.
Yeah.
Just like if you stop using your cream at night in your hands or your face is going to get dry. You're not going to get the benefit if you don't use it. So
Right.
it's safe. We got to use it nightly as our part of our routine. I usually tell them to use it at night, right before they go to the restroom and they're about to go to bed, because most people pee less at night than they do in the day. So we just want to keep the cream as long as possible.
Makes
But
sense.
Dr. Thorley's going to show us where to put it.
Yes. And when we use this vaginal estradiol, like we said, we're going to get less incontinence, less urinary tract infections, more vaginal lubrication, healthier vaginal tissue, and more pleasure with intimacy. So many benefits, so worth asking your doctor about. So where are we going to put it? Like Dr. Diana Londoño said, you can use that applicator and load up a 0.5 to 1 gram in the applicator so that you can get an idea of how much that is. And then you could put it on your finger, and then you could apply it to the inner lips, the inner labia, the urethra, which is right under the clitoris. That's where we urinate from, and the clitoral area. And then you could rub it into the internal, just finger depth internal, into the vaginal canal. You could do this twice a week. Like she said, you could use a pea-size amount and just sort of kind of eyeball it and rub that amount in with your finger. You could also use the applicator if you wanted, just so that you can get an idea of how much 0.5 gram is, because we might not just by eyeballing it know how much that is. That's the use of low-dose topical vaginal estradiol, so that we know our anatomy. This is the vulva. The vagina is the inside, the birth canal. The vulva is the part that you can see and touch, the outer labia, the inner labia, the clitoral hood, the clitoris underneath, and the urethra. And then the vaginal canal is where our birth canal. But people call this the vagina, but this is the vulva.
Absolutely. It's so important to know where to put it. And again, know that it is very safe, and you just need a small amount, goes a long, long way. And there's other options we're going to talk about here briefly, not to confuse you, but just to let you know there's other options for some women that have different preferences. Maybe you don't want to put the cream every night or 3 times a week, or you don't want to do that. Well, there's other options. The first one we talked about, again, is a cream. We should just put that little pea-sized amount in the vulva. At this point in time, is usually the least expensive. So in a way, that's just easier because it's less expensive and you don't have to, worry about that part of it. But there's also a estradiol vaginal pill that you put with a little insert up into the vagina, and you do this twice a week. And so for some women, this may be something easier to do. And the price is about equivalent. There's also Invexi, which is an estradiol cap. There are these little inserts that you also place into the vagina, more expensive, but it could be an option for some women. And that ring that has estrogen as well. And this is changed every 3 months. You can do yourself. You don't have to go to the doctor to change it. But in some women that maybe have a lot of difficulty, they could always go to their physician and have it changed every 3 months. This is lower dose than a birth control ring, but it does have that local estrogen effect. So it will definitely help lubricate those tissues. So again, these are different options that you can use. But again, know that there are options. Start that conversation with your physician to ask what is best for you. But definitely, if you're in menopause, you should start something to prevent all those symptoms from happening, the itching, the burning, the urgency, and more importantly, the infections that are really our big risk.
Absolutely. And also, just important, when a woman picks up a prescription for her vaginal cream or tablet or capsule, there will be a package insert that will give the woman all of these worrisome possible side effects, breast cancer, stroke, dementia, all of these totally out of bounds, worrisome things. And the reason is because the package insert for the vaginal estrogen cream is the same package insert for the birth control pill. And of course, this is not the birth control pill. It cannot be used as birth control. It doesn't work that way. It's very low dose. Like we said, it's only absorbed in the vagina. So it'll never stop a woman from getting pregnant. But the other thing is it won't go into her whole body. So it doesn't have the same risks as systemic hormone therapy. But our FDA makes us put an insert that has the same risk as the birth control pill or systemic hormone therapy. So it's important that we know as women, when we see that insert, it's not accurate. It does not have those systemic risks.
Yeah, and there's many lobbies of organizations trying to change that insert because it scares so many women. They pick up the medication and they're like, I'm not going to use it. So I always warn my patients before they pick it up. That's what the insert is going to say. I understand it's there. I would not prescribe it if it was going to cause cancer. And so just don't be scared because this label is really outdated. But yeah, this picture is great because it's showing you if you use the inserts, the little tablets, where they go. It's sort of like a tampon, but it's going to go in that little tablet. Then you take out the applicator. It just helps to guide it. And the ring just sits in the vaginal canal as well. And again, it can be removed yourself. You could do that. Or if it's very challenging, or somebody is older and doesn't have the dexterity, then their physician can do it for them. But usually you could do that yourself.
Absolutely. So finally, just once again, so if you go to the pharmacy and you get a copay of like $200 on your estradiol cream, don't pay $200. Go on GoodRx or go on Cost Plus, plug in estradiol cream or tablet, and get a coupon for your pharmacy so that you can get that $30 or $40 price, not the hundreds of dollars that some pharmacies or insurance companies want to charge you as a copay. It's so important to treat genitourinary syndrome of menopause for all the reasons that we talked about. And so many women suffer needlessly those symptoms. Some symptoms in menopause, like hot flashes and night sweats, they go away sometimes over time. Our body just sort of goes through a transition and it goes away. But this one right here, genitourinary syndrome, it doesn't usually go away. In fact, it gets worse. And like Dr. Diana said earlier about those UTIs, those urinary tract infection, they can be life-threatening because sometimes older women in later menopause, say 70, 80 years old, they don't even feel their UTI and they don't even know they have a UTI until they're really, really sick. So treating our genitourinary syndrome can save our lives. And our sisters and our cousins and our moms and our grandmothers, if we let them know about this information, it can be life-saving for them too. Not only will it save their life, which is so important, prevent urinary tract infections, treat that bladder urgency and frequency. A lot of women think it's just inevitable. I'm going to have to wear diapers when I get old. And we don't have to take that lying down. We don't have to accept incontinence as a given in our old age. We can be proactive, like Dr. Diana said, with the pelvic floor physical therapy, with the Kegels, with the estrogen. We can be proactive and maintain our dignity and our confidence and our sensuality. We can have better vaginal tissue health, better lubrication and sensation of the vagina. And all these benefits are at our disposal if we ask for help. We have to ask for help. We have to talk to our doctor, or otherwise they may not bring it up.
Yeah, and if you don't get that from your primary, go to a gynecologist, go to a urologist. Again, there's many places you can get this prescription. Anybody really could prescribe it. I even prescribe it when people are in the hospital to get them started. But really, if you're not getting the help, go to a different physician, again, so you can get help. This is really important.
If you're the kind of woman who has a urinary tract infection and another urinary tract infection, you're in your 40s or 50s, and you've gotten antibiotic after antibiotic, or a yeast infection after yeast infection, you can ask your doctor about whether treatment for this genital urinary syndrome can help you prevent both of those. Thank you so much for listening to us. For Dr. Diana Londoño, board-certified urologist, and me, Dr. Victoria Sorlie-Aguilar, family physician, Feminine Flame MD. This is not intended to be individual medical advice. Of course, this is for educational purposes only. We all deserve to talk to our own doctors about our personal healthcare symptoms and history. But we should talk to our doctors. We don't have to be embarrassed. We don't have to suffer in silence. We can and we should get help.
Yes. Thank you so much for listening.
Thank you.